Hello, I'm Dr. Trivedi. I'm a doctor working here today. May I confirm your name and age, please?
Hi, doctor. My name is Amber and I am 55 years.
Okay. How may I address you?
Please call me Amber.
Okay. Amber, today we are going to discuss about your health issues. Will that be all right?
Okay, doctor, no problem.
Okay. And during our conversation, I might take down some notes which will be strictly confidential. Is it okay?
All right.
Okay. Amber, can you please tell me in your own words that what have brought you here today?
Actually, doctor, I have been suffering for last 6 weeks. I noticed that I am getting much thirsty than usual, and I need to pass my water more frequently than usual. And I also feel some fatigue, and I could cope up with it somewhat, but that problem was increasing. So I visited my GP about 2 weeks ago, and then he ran some blood test. He also did some my diabetes test, and after that he said that I have diabetes, and he gave me medication called glycoside, and I am taking that. And at that time, he also took blood to test other like my kidney, liver, and the results came a few days ago. And doctor said that there was some problem with my liver, so he referred me here.
Okay. Okay. I get it. I get it. Well, well, you told that around 6 weeks back you started to have that symptoms, and you're having some problem. Well, can you please tell me that do you have any problem with your water work apart from to going more frequently?
Yes, doctor, that is one issue that I have noticed that the water has become somewhat darker.
Okay, for how long?
Maybe for last 6 weeks.
Okay, darker. Okay. Have you ever observed any blood?
No,
Okay. Is there any frothiness?
no.
Okay. And you told that you lost some weight. May I know that is it intentional or unintentional?
Totally unintentional.
Have you ever measured it?
Yes, doctor. That will be about 12 kg over last 6 months.
12 kg over last 6 months. So you told that there are but you told about 6 weeks actually. Is it 6 weeks or 6 months? Can I please can you please?
My water problem is for last 6 weeks, but I
Okay, and
my weight
it
since
will
I noticed it for last 6 months that I am.
okay, that's very good. That's all right for helping me out. Okay, and can you please tell me that is there any problem with your vision?
No,
Okay, any tingling or numbness in anywhere in your body?
no,
Any pain anywhere in your body?
no.
Okay, any chest pain? Any chest
No,
pain?
no chest pain, but I have some pain in my upper tummy.
Okay, can you please tell me where is that pain? Right, upper tummy. Is it just in the central part or in
Uh,
right or left part?
in this mainly on the center part, and sometimes it goes back.
Okay, sometimes it goes back.
Yes.
Okay, can you please tell me when did it first started?
I can tell you that it may be for last 6 months.
Okay, for last 6 months. Okay, has it increased or decreased in frequency? Have you
Uh,
noticed?
it is increasing in frequency.
Okay, can you please tell me that for at the beginning, for how long did these pains persist?
When it started, it persists for maybe about 1 or 2 hours.
And now,
Now it persists about 5, 6 hours, sometimes whole night.
5 to 6, sometimes whole night. Okay. Can you please tell me that does it radiate to any other side other than the back or just the back?
Just back.
Okay, can you please describe the pain for me?
The pain is sometimes so severe.
Okay.
Cannot tell you, but it is very severe pain.
Okay, is there anything that makes it worse? Any type of food or something like that?
No.
Anything that makes you feel better? Any positioning?
Nothing but remaining still with some inclining forward makes me
Okay,
feel somewhat better, but not so much.
okay, I can get it. I can get it. Well, can you please tell me that do you have any episodes of bleeding? Any episodes of vomiting or nausea?
I feel nausea, but I haven't vomited.
Have you ever noticed any blood from your throat that came out?
No.
Okay, and okay, and may I know about your bowel movement? Is that all right?
Uh, no, doctor. I also noticed some changes in my bowel that it has become somewhat loose
Somewhat loose. Okay,
and
can you please tell me whether is it difficult to flush away or is it all right?
difficult to flush out.
It's difficult to flush away. When did you first observe it? 6 months timing,
For the 6 months, along with my pain in tummy.
along with the pain. Okay, is there anything that makes it better or worse?
No, I haven't noticed.
Okay, any bleeding from your bowel movement?
No, I haven't noticed.
Okay, do you feel any? May I ask you? Do you feel any problem while in your vision while going out in the night or something like that?
Not like that, but when I try to stand up from the sitting position, I feel
Okay.
somewhat blurred.
You feel somewhat blurred. Okay, okay, and okay, and can you please tell me that do you have any pain while standing from sitting position?
No,
Okay, any bleeding episodes any time in your any bruises or something like that?
no,
Okay, okay, and may I ask you some other questions? Do you have any racing and pacing of your heart?
no,
Any swelling in it? Sorry, any leg swelling?
no,
Do you have any extra pillows? Do you have to use?
no.
Okay, and well, may I know that did you have any other? Did you notice that any yellowish discoloration of your body?
No, not this time. But that was about 15 years ago when I had jaundice, and then I visited my GP. They found that I have some stone in my gallbladder, and
Yeah, yeah, yeah.
operation was done at that time.
Okay, can you please tell me that any idea that what actually, okay, do you have any idea what actually happened in the operation or what operation did take were done?
I just removed gallbladder.
Okay, they removed the gallbladder. Okay, okay, and since then have you been completely well?
No, since then I didn't have any problem.
Okay, and can you please tell me that did you have any episodes of fever recently?
No,
Okay, okay, and and may I know that you since uh, detection of diabetes, you told that you have been prescribed some medication. Can you please like glycoside? I think. Can you please tell me the dose of it?
no.
Okay, and any other medication that you have been taking?
Yes, doctor. I have some lung condition called COPD. For that, I take some inhaler, and also I have high blood pressure, so that I take thiazide and another drug I cannot remember.
Okay, okay, and you told that you take something for COPD. Can you please tell me that whether that inhaler consists of any steroid medication or something like that?
No steroid.
Okay, okay, that's all right. And you told that you take the thiazide for your hypertension. May I know for how long have you been taking the thiazide drug?
5 years.
Okay, any recent dose change?
No,
Okay. Any allergy to any medication
No.
or any over-the-counter medication?
No.
Any herbal medication?
No. No.
Okay. May I ask you some family history? Do you have any member of your family having any chronic disease like diabetes or something like that?
No. I don't know.
Okay. Any history of sudden death?
No.
Okay. And any okay. And may I ask you about some personal questions? Do you smoke, December?
Yes, doctor.
How many sticks per day?
About 10 to 15.
Okay. For how long?
Maybe for around after due. Usually, I started taking around when I was 20.
Yeah, yeah. So it's very harmful for the health. It's better to stop it. And if you like, we would refer you to the smoking cessation clinic. Will it be all right?
Okay, doctor.
And do you take alcohol, Mrs. Amber?
I take a very little now.
Okay. For since when have you reduced taking it?
For about 5 years. And,
Okay. Before that, how much would you like to take? Would you usually take?
that was so heavy, doctor. Sometimes you go to at the weekend.
Okay, okay, I get it, I get it. And since you are reducing it, it's very appreciable. It would be better if you reduce it more. May I ask you another personal question? Do you take any recreational medication?
No, never.
Okay. May I ask about your menses? Is that all right now, or has it stopped?
Stopped.
Okay. Okay. And do you take any pills now?
No.
Okay, that's all right. And may I know about? Do you have any children? Or I'm again sorry, that's a personal question. But can you tell me? Do you have any children or not?
Yes, doctor.
Okay. How old are the youngest one now?
23 years.
Okay, that's all. Yeah, okay. And may I know that? Okay. What do you do for a living?
I'm a office clerk.
Okay. And may I know that how are your symptoms affecting your job life?
A little bit, not so much.
Okay, 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 that's all right.
Similar.
And whom do you live with? Whom do you live with? Live with?
My husband and children.
Okay. Do you need any social support? Think.
No, I think I am happy with my family.
Okay. Okay, that's all right. Well, can you please tell me that? Okay. Can you please tell me what your concerns are?
Why I am having this? Do you have a problem with my liver?
Okay. At this moment we are at the moment, first of all, we will have to examine you properly and also uh, assess you, uh, uh, and after that we can get to you properly. But since say, as long as I've taken the history, I think that you may be suffering from a condition named chronic pancreatitis, or it can also be sometimes notorious in your pancreas. Yeah, we are not sure at just at this moment, but your symptoms like detection of diabetes, and also the appearance of your stools, and also your pain in the upper tummy. Okay, these actually refer to that condition. Okay. So, however, we are not. I'm sure at this moment we will have to run some blood tests and also some scanning tests. We will also involve the bowel doctor and our consultant, so that they can look deep into the matter and find out the actual cause. However, there are some things that you should reduce since they increase the condition, like smoking. Smoking is very harmful, and it can also cause damage to your this pancreas. Okay, so it's better that you
Alright.
stop this as soon as possible. Hello.
Okay, doctor, is it a very serious condition?
Well, to be frank, at this moment, it's difficult to tell that whether it's very serious or not. But after taking the scans and doing the blood test, we might be able to confirm you and say it more profoundly whether it's serious or not. Are you getting me?
Okay, doctor.
Any more concerns?
Why did I lost
Any more?
weight? Was it due to my diabetes or anything serious?
Well, actually, what is this? That the diabetes itself can be caused by this condition of your tummy. Okay, that pancreas. Okay. So at this moment, before doing the examination, it might not be told for sure, because even the diabetes itself can cause weight loss, and again, if it is caused by the condition of your tummy, this can also cause weight loss. So at first we will have to find out the cause, then we can be sure about it. Are you getting me?
Okay, doctor.
Any more questions or concerns?
No, doctor, thank you.
Okay, okay.
So, what are the differential diagnoses you have for this lady?
uh, I think she might be suffering from diabetes mellitus secondary due to chronic pancreatitis or carcinoma of the pancreas, and this is the main BD. And she might also be suffering from any cholestatic jaundice due to due to his, yeah, I think due to his medication named glycoside. Okay, and due to his medication named glycoside. So I think these are the differentials at this moment for me.
If she has raised all the transferase level and also raised bilirubin, for this, do you have any differential?
Uh, uh, I just can't remember at this moment. I'm sorry.
Okay, do you think that her alcohol also cause some problem with her liver function?
That's very much possible
So,
because
alcoholic
she,
liver disease
she
is a
was,
differential, and also there may be some problem with the biliary channel, like a stone in the biliary channel or primary biliary cirrhosis, that
yeah,
also
yeah, yeah,
can cause this.
yeah, yeah, yeah. That's also true.
And though unlikely, but hemochromatosis is also a possibility.
Okay. Yeah. Just forgot it. Yeah.
For this lady, most
Yeah.
probable diagnosis was most likely due to carcinoma of the head of the pancreas because she has drastic weight loss, and also all
Yeah.
the liver functions were raised,
Yeah.
and also there were pain.
Mm.
Solely,
Yeah. Yeah.
solely chronic pancreatitis couldn't raise the liver function test. So there is likely to be an obstruction. So I will investigate her.
Yeah. So I think okay. So I think that first of all I would go for routine blood tests like CBC, ESR, CRP, and CBC, ESR, CRP, and then I will go for ultrasound of the whole abdomen, and also CT scan of the whole abdomen, and also I will go for CA 199 for this patient, uh, and then I might go for HbA1c, and I might go again for the liver function test to evaluate, and also some ferritin, serum ferritin level, and also some autoimmune profiling like antimicrobial antibodies.
Okay, that is fine. So for this lady, there were she said that there were some problem with her diabetes. So you taken the causes what was causing her diabetes. Okay.
Yeah.
For weight loss, you have taken the history. History was fine. There was no problem. Drug history, that was also fine. You could have asked about OCP because OCP causes
Yeah, I
questionable.
told about pain,
And
but she
okay, okay,
refused it.
okay, that was fine. This patient was postmenopausal.
Yeah, yeah, yeah. Okay.
But this was actually fine. You have done it well. And one thing that you could have asked that to evaluate was this is a case of prehepatic, hepatic, or post-hepatic jaundice. I cannot
Yeah,
remember
yeah,
if you have asked about fever, any itching, any
yeah.
any fever wheezing. I cannot remember. Anorexia, nausea.
Yeah,
I
I
cannot
didn't.
remember
I
if you
didn't.
have
I asked about fever, but I didn't ask about itching. I didn't ask about itching.
anorexia, nausea.
No, sure, I didn't ask.
Okay. And also travel history, that was important.
I think. Well, can you please tell me that what is the cause of the darker urine here?
Okay, it was a cholestatic jaundice.
Yeah, so it can be darker.
Obstructive
Correct?
jaundice, yes.
Yeah, yeah. Okay.
And also travel history, because some infection in the liver can caused by travel to certain area.
Yeah, yeah, yeah. Hmm. Okay. And can I've just forgotten? Can glycoside call this cholestatic picture? I think it's so. Am I
This
right?
her blood was taken before starting the medication.
Oh, okay. Mhm. Okay,
Glyceride
okay.
can cause sulfonylurea
Yeah,
and
yeah, yeah, yeah,
sometimes cholestatic picture.
yeah, yeah. Yeah. Okay, okay. That's all right.
Okay,
Well, yeah.